Today, I have to be honest, this is more a talk for parents and players, just in terms of what happens transporting injured athletes from the rink to the emergency department and what happens in the emergency room a bit. So for those therapists, I'm going to show you some slides. Please don't critique the techniques that we use. Everybody always has a different way. But what we'll do is, I have to show you the prerequisite sort of videos of some injuries. And then I'll show you what we do in preparation to move somebody to the emergency department. And the key there is it just takes time. It takes time under the best circumstances. And I feel for parents who look out on the ice and see their injured child, male or female, and wonder, why is this taking so long? What is going on? Are they injured? And what I want to do is show you a bit that under an ideal circumstance, it takes a lot of time just to move somebody who's not injured. As Vincent says, perfect practice makes perfect. That's what we try to do. And I'll show you how long it can take to move somebody who's not even injured. So I hope to give you a better understanding, and hopefully it doesn't happen to your child or somebody on your team. But if it does happen, you may just be comforted by the fact that knowing that it takes a lot of time to remove somebody properly to transport them from the rink to the emergency room. And I'll talk finally a little bit about what we do in the emergency room so that you can know what to expect. So, top of the screen, that's one of our McGill players. He's actually studying medicine now. So you may not want to see him. I'll give you his address. So no, but he's doing very well. And this is, so injuries do happen, obviously. So you've seen a couple of injuries that happen, and who knows what happens there? Who knows if the player likely has a concussion or what have you. But as Vincent sort of pointed out to you, as you move down the algorithm of how to care for an injured athlete, airway and breathing and neck and not making a neck injury worse really dictate how we behave. So we have to take care to get the airway patent and breathe for the athlete. And then we want to make sure if they have a neck injury that we don't make it worse. And this can be a very scary thing. I work in the emergency department, as does Vincent. And Mark, I think, has done some emergency work as well. I get nervous when these things come in on an ambulance under a bright light, and I'm standing here, and the player's on a stretcher that's here. This makes me very nervous in the emergency department sometimes. You can imagine on the ice, when I slide out on the ice, one-legged sort of curling out there, my sphincter tone gets a bit tighter. I think Jamie would understand that. So you may not see it on my face, but it's happening. And this is something that, you may or may not be aware of. Different physicians have different comfort levels with different problems, So I know things that Jamie doesn't know, and he knows things, and so on and so forth. And I remember a few years ago, my father learned this firsthand. We were doing the CASM exam, and he volunteered as a patient for back pain. And I sent him in with one of my orthopedic friends. He spent the whole day there. And my poor father came out at the end like, blah, 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 blah. I said, Dad, what happened? He said, well, he had a herniated disc, and he had pain down both legs. And he said, one guy wanted to cut my legs off. And it just, people think every doctor knows the same thing. It's not the case. So, and therapists probably know this. Oh, no, Delaney's coming tonight. He'll be up talking in the stands, or Lacroix's coming. He sits behind the bench, and he's attentive. Delaney's off meandering. Different doctors are familiar with different things, and they have different personalities. So in terms of, the full immobilization, this is where we get everybody bundled all up. Who do we have to do that to? We have to do it to people who are obviously unconscious or confused or not fully awake. And this is because, and Jamie sort of touched on this, you're not sure whether, if I have a bad head injury and I have a neck injury, I may not even realize that. So we have to be safe. Obviously, neck pain and neurological symptoms we're going to take care of. The other thing is if a player has, crashed into the boards, going back to the Medano video, and they have a fractured femur, that hurts like you wouldn't believe. If you have a small fracture in your neck, you may not realize that you have something going on in your neck because you're so distracted by the pain in your leg. So oftentimes when there's sort of an injury and somebody goes down and they have a lot of pain in their leg, we'll immobilize their neck. And again, for the parents out there, you may think, oh, what is going on here? Why are they immobilizing them? It's because we can't trust that athlete to detect possibly a small fracture in their neck, okay? Here in Quebec, there are two ways you can get immobilized. On the left-hand side is sort of the new sandbag, which is great for the ambulances, and the athlete likes it because they blow up this bag and then they suck out all the air, so it really sort of holds the athlete in there. It's a bit of a more difficult situation in the emergency room. And on the right is a more traditional hard backboard. So again, it takes a long time to go from the left-hand part of the slide to the right-hand part of the slide. So I went recently and sort of took photos of the McGill hockey team and the therapy team there, immobilizing an athlete in running shoes, which is not often the case for a hockey player. But you see, as they start there, and again, this is with a full team there, 5 people, and it takes a lot longer. Therapists will tell you when there's just 1 or 2 and they have to drag in somebody to help them out. It takes a while. They immobilize the feet. They start immobilizing the hands. Again, always, you see at the head, they're always making sure that that head is immobilized to keep the neck in the right position so there's no risk of further neck injury. You'll see there they're going to take the helmet off, and I'll show you how long that can take under the best of circumstances. They roll them onto the side, they put in the backboard, always making sure that the neck is immobilized and not moved at all. They roll them back, and then they start strapping them up so that they can be placed on an ambulance. That took about 10 minutes. Just, not on the ice, which is much more difficult, just there with a team that practices this all the time, okay? Sometimes they'll leave the helmet on, sometimes they'll take it off. If you see the picture there, that high-tech orange line I drew in is meant to sort of show that the cervical spine or the neck is in a good position. So the shoulder pads lift you a little bit farther off the ice, and luckily enough, the helmet sort of catches the head around the same distance off. So it's almost like if you're lying flat with no helmet or shoulder pads, it's the same thing when you have hockey shoulder pads on in a helmet. It keeps everything nicely aligned. If you don't have that, you'll see there's a big space. And the last thing you want is for a player who's on the ice and you take the helmet off to do this. Because if they have a fracture and things are sort of splinted, you can now cause things to move and make an injury that wasn't so bad a lot worse. So if you're going to take the helmet off, the therapist will sort of tell you have to be prepared. So again, for parents and players out there, they may take your helmet off, they may take it on. It may have nothing to do with what's going on. It may not be a head injury. It's just to make sure that the neck is properly immobilized. This is how long it takes to take a helmet off under the best of circumstances. So this is 2 people, obviously. And anybody who's done football knows it's a lot harder because the football helmets extend farther down and they sort of are tapered in a bit, so you really have to pull harder to get the helmet off. Again, we're taking it off now, so we know that if we just let it go, the head is going to fall into extension and you may make a neck injury. That there was a fracture with no spinal cord injury. If you let the head fall down, you may make a fracture into a paralyzed situation. And I'll tell you something, they did this twice because the first time they felt there was too much movement. And again, this is a team that practices this all the time. So she's sort of sliding her hand up the back of the head to take the weight of the head. So they're trying not to move his neck. And then he takes control of the head. So again, that's in a non-injured athlete who's completely awake, who's not waking up and starting to thrash about and be like, what's going on? Qu'est-ce qui se passe ici? So it takes time. Now, when you get to the emergency room, this is obviously what you see. Anybody who's waited in the emergency room for hours in Quebec knows this is the happy greeting that you get when you come in, if you bring the Grey Cup with you. Otherwise, you wait 8 hours, right? So, but they're really, parents oftentimes want to know, so they're brought in, what kind of test are they going to get? And really, it's not necessary that you get a test, but if you are going to get a test, most of the time you'll get a CT scan of the brain. You've seen different pictures of that. Jamie showed them and what have you. A CT scan is very fast. You can be in and out now in about 3 to 5 minutes, and at the same time, we can look through the neck so we can see are there any injuries to the neck. It is an X-ray, so there is radiation. Jamie sort of touched on it again, that in young children, really we're trying to move away from that because we know the younger they are and the more X-rays that they get, and CT scans are many, many times more radiation than an X-ray. Just doing them because the kid hit his head and he has, had a little bit of a headache for a young child is probably not a good thing. But in an athlete who's in there with some of the things we'll talk about, you want to get a scan on there. An MRI, people always, sometimes I get asked, why don't I get an MRI? Isn't that a better test? So if you look at the bottom, just comparing it to the CT scan on the left there, you'll see that you see a lot more things. It just looks like a sharper image. It takes a lot longer to get an MRI. It takes about 20 to 30 minutes. If anybody ever have an MRI in here? You're in there for a long time, a tuck, 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 that's making sounds and what have you. You don't want a half-awake patient in there. It's very good for seeing detail, but it takes a long time. And an MRI is not an X-ray. It works with magnets, so there's no radiation, which is very good, but you cannot go in there if the patient is hooked up to monitors that have metal on them, or if you've had previous type of surgeries like possibly a piece of metal in your eye. It's not a big deal if you have if you've had a forearm fracture, because they're just worried about metal that may move a tiny, tiny bit. So it's metal around your heart and in the eye or in the brain that they won't let you go in for. But when you look at that, it takes a lot longer. You can't give it to everybody. So most people who are going to get an image of their brain are going to get a CT scan. So that's why they'll get a CT scan. It's quick. You can do it with metal as opposed to an MRI. Who gets a CAT scan? In the emergency department, as Jamie again touched on. Thanks for touching on everything, Jamie, in the talk. There are rules that we have because we don't want to start scanning everybody. So obviously somebody who's unconscious or who has a big neurological, they can't move their arm or leg or what have you, is going to get a CAT scan. But for the less obvious cases, normally, and just to explain it to you there, a GCS score, all that means is 2 hours after the injury, they're still confused. So they're talking, but they're just not always making sense or what have you. They can move their arms and legs, but 2 hours after, they should be starting to clear up. Anybody who's suspected of having a fracture, or people who continue to vomit. So anybody who's had a child knows that kids will vomit at anything, but if they continue to vomit or vomit more than twice, that's a risk factor, and we'll oftentimes scan them. Or people who have amnesia, who can't remember the impact or before that. So after the scan, so let's say you have it and everything is okay, what can happen? You may or may not get a scan. Remember, if you don't meet those criteria, you may not get it. Well, sometimes you'll be sent home, and oftentimes they'll give you a sheet of paper, a head injury discharge sheet, where they'll say, okay, this is what to look for, and keep an eye on the person and what have you. And they've done studies on that type of discharge situation. And really what happens is, if you're there with your buddy, he walks out the door and he says, all right, Howard, have a good night. We'll see you tomorrow, buddy. There's none of this waking them up. Can anybody, if you want to speak to one person who's going to do what you tell them to do when you have an injured athlete, do you know who it is? The mom. Only moms will do what you ask them to do. Friends, colleagues, dads, they just have a good night, son. Hope you wake up tomorrow. Moms will be in there, wake up, okay, you're awake. So don't just give them a sheet and think nothing is going to happen, that everything will be fine. You have to make sure that they understand that. They may be observed in the emergency room, or they may be admitted to the hospital for observation or treatment. If they don't get a scan, oftentimes they'll be observed for 4 to 6 hours. And really, we want to make sure that their symptoms are at least stabilizing or starting to improve a bit. So we don't want somebody who has a bad headache to send them home right away, because we want to make sure that headache doesn't get worse and worse and worse. So oftentimes you'll be asked to stay in the emergency room for 4 to 6 hours. And you may want to leave, but that's just to make sure that the symptoms are not going to get worse and nothing bad is going to happen to the patient. Again, when you go home, hopefully you'll be given some type of follow-up, because studies have shown that athletes after head injury, after concussion, do better when they have follow-up. And I mean do better, I mean that their concussion symptoms resolve quicker and their concussion symptoms are less severe. Whether that happens because they get education and what have you, it can be with a hospital program, and the Children's has one of the best head injury programs. I have to give them credit where credit is due. They're fantastic at it. So here in Montreal, I think they're probably the best of the English hospitals here. It can be with your family physician, it can be with a sports medicine professional, it could be with anybody, a neuropsychologist. Just have them follow up, okay? Because they'll do better in the long run. So just in summary before we head for lunch, remember, as parents and athletes and people watching, it takes a long time to get somebody who's been injured on the ice under the best of times, under the best of circumstances, ready to transport to the emergency room. It doesn't mean that there's a serious injury. It doesn't mean that there's a problem. That's just how long it takes, because as Vincent said, we're preparing for the worst case scenario. They may or may not take the helmet off, so even though something may have happened to their leg, they just want to be sure if they're distracted by pain that they don't have an injury in their neck, and they may take the helmet off just to keep the spine immobilized. In the emergency room, if they're going to get a test for the brain, they'll probably get a CT scan and not an MRI, and that's just because it's very quick and you can do it with metal and not have to worry about it. And hopefully when they get sent home from the emergency room after a CT scan or after observation, they will get some sort of follow-up, because this will help them recover quicker and recover with less symptoms. Thank you very much. Merci.